Hey, it's Emma Chamberlain. I designed these new glasses for Warby Parker and I basically can't take them off. Like, I'm showering in them and sleeping in them. They're just that good. Go see them all at warbyparker.com. And you know what? Have a good day too. Okay? All right? Bye.
Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast, where I teach concepts and share tips so you can thrive in nursing school and at the bedside. Today, we're talking about a foundation concept. We're going to be looking at the key differences between acute pain and chronic pain. Now, before we do that, of course, I do want to take a quick minute for our listener shout out. And this one goes out to Laura F., who says, prepping for second semester with Crucial Concepts Bootcamp and finding it so helpful. Also, love Nurse Mo's podcast for on-the-go learning. Thank you so much, Laura, for letting me know that you are finding Crucial Concepts Bootcamp helpful as you prepare for second semester. I'm so glad because second semester, depending on what your school teaches in that semester, I know where I went to school, second semester was a doozy. So I'm glad that you're going into it feeling more confident. And I'm also really happy that you love using the podcast for on-the-go learning, which is exactly why I made it. So thanks again, Laura, and best of luck to you. So if you're curious what Laura is talking about with my boot camp, that is my nursing school prep course, which teaches foundation concepts so that you don't hear them for the very first time when you're in your first semester classes. And I also share success strategies, test-taking strategies, how to take notes, how to do dosage calculations, all kinds of things that set you up for success. So I will put a link to that in the episode notes. Of course, you can always just go to the Straight A Nursing Student website and click on courses in the top menu bar. Alrighty, so today we're talking about acute versus chronic pain. So pain management definitely is a very complex component of nursing care. It's one of those things where it's really complex, but it's also one of those things where it's really common because you will face pain management basically every single day you work at the bedside. And yeah, while at first glance, it might seem like pain is simply asking the patient for a pain score, it is actually a multifaceted experience that can vary widely from patient to patient. In general, though, pain is an uncomfortable sensation that lets us know the body is experiencing illness or injury. Now, it's really important to understand, even though that's kind of a blanket statement about pain, that pain is not the same for everyone. What is painful to one person may not be that painful to another. And this is simply because everyone's body and nervous system are unique and different. This is why you might hear a patient say something like, well, I have a really high pain tolerance. Or why you might notice that two patients recovering from the exact same surgery report wildly different pain levels. Now, when we are talking about pain, we're actually talking about several different types of pain, and I have covered those in another episode, and that is episode 309. It's called Pain Essentials for Nursing, and in that episode, I talk about the different types of pain, including nociceptive pain, visceral pain, neuropathic pain, etc., and also looking at a pain assessment and different pain scales that you might use, and also doing that OPQRST full pain assessment, as well as a little bit about pain interventions. So if you want to take like a deep dive into that component of pain, definitely go and check out episode 309. For today's episode, what we are talking about is the general difference between acute and chronic pain. So first, what is acute pain? So remember, acute basically means new. So acute pain is a sudden onset of discomfort or distress resulting from an identifiable injury or illness. You want to think of acute pain as an alarm system that alerts you to potential or actual harm. For example, just the other day, I was working in my front yard. We're doing a big landscaping project, and one of the plants that we got, it's really pretty. I can't tell you the name of it, but I can tell you that it's pretty, but it's also really pokey, and it kept poking me with these sharp spikes. Well, that was acute pain, right? It was my body saying, hey, stop touching this pokey plant because you could get really hurt. So you want to think of it as an alarm system. Now, acute pain is typically of short duration, and it resolves once the underlying cause is removed or the tissue heals. In my case, the painful sensation ended as soon as I pulled my hand away from that really pretty and pokey plant that I was trying to get in the ground. Now, if I had scraped my hand or even punctured it, then yes, the pain would have lasted beyond me pulling my hand away, but once that tissue healed, the pain would resolve. Note that acute pain can, in some cases, evolve into chronic pain if it turns out that the pain signals start malfunctioning, aren't sending signals appropriately, or if the tissue heals incorrectly. So a great example of this might be, let's say that I break my foot and it's not set properly. I could have chronic long-term pain from that, even after the bone injury itself has been repaired or that bone has healed. So in summary, acute pain is sudden. It's basically going to be of short duration and resolve once the underlying cause is removed or that injured tissue heals. Now, the key characteristics of acute pain are, we're going to look at causes, duration, quality, and impact on life. So looking at causes, examples of some causes for acute pain are surgery, injury, burns, childbirth, menstrual cramps, and broken bones. Of course, it could be all kinds of things, right? But those are some examples. So when you're thinking about acute pain, that might help you think about some causes and occasions where somebody could have acute pain. Now, duration, I saw different parameters for this. I saw in some cases the resource saying that acute pain resolves within 3 months, and in other cases saying it resolves within 6 months. So I'm going to say acute pain generally resolves within 3 to 6 months, but of course, in many cases, often much, much faster. For example, if you're gardening and you poke yourself with a really pretty but pokey plant, that pain's going to resolve very, very quickly. So that was the duration of the pain. The quality of acute pain, in most cases, it's sharp and localized, but it could also be a throbbing pain or a cramping pain. And then its impact on life. So with acute pain, the disruptions to the individual's regular daily life are short term, and it could be things like limited mobility, like when I bashed my toe against my cat's scratching post in the middle of the night and said a bad word and then went on about my business, even though it really hurt. Turns out I had broken my toe and I had some limited mobility and pain with mobility for a little while. So that was a short-term disruption. Acute pain can also cause anxiety. It can also cause fear. And I see this a lot as a nurse that works in the post-surgical, in the PACU, in the recovery room. Patients, especially if they're experiencing a high level of acute pain, there is anxiety and fear along with that. So sometimes if you can help the patient control their anxiety, get their fear under control, that also kind of helps with the pain management. It helps them cope with the pain in a much better way. And this anxiety, this fear is going to resolve and go away as the pain decreases. And then again, if the injury is not treated or if it heals incorrectly, then chronic pain can be a result of an acute pain problem. So now let's talk about chronic pain. So chronic pain is prolonged pain that occurs without a clear underlying cause or persists beyond the expected period of healing. So what do I mean by that? Let's say that you are working in the yard doing some landscaping like I was, and you pick up a very heavy mandarin tree, which I got to watch people do the other day, and you hurt your back. Well, that would be an acute problem, right? Because it just happened. But let's say none of the treatments that you go through help, and 9 months later, you still have pain in your back. That would be a case of the pain persisting beyond the expected period of healing. And in most cases, chronic pain is experienced by the individual most or all days of the week and lasts longer than 3 to 6 months. So chronic pain, again, is prolonged, it's persistent, it's ongoing. The individual is regularly experiencing it for a period of longer than 3 to 6 months. So the key characteristics of chronic pain, looking at causes, duration, quality of the pain, and impact on life are this. So causes. In some cases, there is no identifiable cause. And in other cases, the cause is an injury that hasn't healed properly. Like I mentioned just a moment ago with the example of you picking up a very large mandarin tree and hurting yourself. Conditions that commonly cause chronic pain include arthritis, back disorders, very, very common, fibromyalgia, neuropathy, cancer, autoimmune conditions, and migraine. So those would be some common conditions associated with chronic pain. Of course, there are many more, but that should get you kind of thinking about what your patient might be experiencing if they do suffer from, say, neuropathy or an autoimmune condition or something like that. What about the duration? So again, chronic pain typically lasts longer than 3 to 6 months, and the pain can fluctuate over time. It could be worse on some days and better on others, but it doesn't fully ever go away. The patient deals with it all the time. The quality of the pain can also vary pretty widely. It could be sharp pain, it could be dull pain, it could be burning or throbbing. In some cases, it's generalized. A patient may have aches all over their body. So when you're doing your pain assessment, you want to make sure you do a thorough assessment of the quality of their chronic pain. And here's one area where chronic pain really is different than acute pain, and that is on its impact on the patient's life. Chronic pain can lead to all kinds of other associated problems like fatigue, and the fatigue can be pretty debilitating. It is exhausting to be in pain all the time. Insomnia is another one. If you're in pain, you're not sleeping well, that also contributes to the fatigue. Depression, anxiety, and feelings of hopelessness are very common amongst chronic pain sufferers. In addition, chronic pain has significant economic impacts, which you might not think about right off the top, but a lot of times individuals with chronic pain, of course, depending on their pain and the type of work they do, are not able to work. So that has, of course, significant economic impact on that individual. So now let's look at how these different types of pain are treated. First, let's look at acute pain. So acute pain is treated with pharmacologic and non-pharmacologic modalities. Looking at pharmacologic treatments, medications used to treat acute pain most commonly include opioids, NSAIDs, and acetaminophen. So let's first look at opioids, and these are going to include medications like morphine, fentanyl, hydromorphone, hydrocodone, and oxycodone. Of course, there are others, but those are some common ones. And the key thing to know about opioids is that common adverse effects include respiratory depression, constipation, orthostatic hypotension, and sedation. Obviously, with long-term use, opioids can also cause dependency, which is why we try to avoid using them for a long period of time. And when we start talking about chronic pain in a moment, you'll see why we use so many other types of pain management techniques, because we really don't want patients having to rely on opioids long term. And then another type of medication commonly used to treat acute pain are NSAIDs, which are non-steroidal anti-inflammatory drugs. These include medications such as ibuprofen or ketorolac. Now, a key thing to know about NSAIDs is that with continued and long-term use, you are looking at a patient who is at much higher risk for GI bleeding. In addition, NSAIDs can cause hypertension and renal impairment. So let's say you got a patient, they come in, they have arthritis. I see this all the time. And they tell you they take ibuprofen 3 times a day, every day, and they've been doing that for months or even years. Most of the time, when you look at that patient's whole clinical picture, they're going to have hypertension and at least some mild renal insufficiency. And again, the GI bleed risk is definitely there. I cannot even count how many times I've cared for a patient who has had a GI bleed because they've been taking ibuprofen or some kind of NSAID for a regular and sustained period of time. All right, next is acetaminophen, very common. You know this probably as Tylenol. This is most often used to treat mild pain, but may also be utilized alongside an opioid to increase analgesic effectiveness. So a great example of this is the medication Norco, which is a combination medication of hydrocodone, which is an opioid, and acetaminophen, because together they have a more pronounced effect. It's like peanut butter and jelly, right? I love peanut butter and I really like jelly, but you put those two together and you've got an amazing snack, right? So that's what I think of when I think of opioids and acetaminophen. They just work really well together. Now, a key thing to know about acetaminophen is that the patient should not take more than the prescribed dose in a 24-hour period, and that's typically going to be 3 grams or 4 grams. And the reason for this is that even though acetaminophen doesn't really have many adverse effects, when you take too much of it, it has really bad adverse effects, and that is that it can cause acute liver failure. So if your patient is taking a combination medication like Norco or Vicodin or Percocet, one of those medications that have an opioid component and an acetaminophen component, you want to make sure they know not to double up or take it more often than necessary, not only because they could have the bad side effects of opioids like respiratory depression, but they could also really harm their liver by taking too much acetaminophen. And they should also be instructed to look at other over-the-counter medications that they might be taking, like a cold medication can often have acetaminophen in it. So they need to keep an eye out for that so that they don't accidentally take too much acetaminophen. And then corticosteroids. Now, I didn't mention these in the commonly used medications for acute pain because they're not as commonly used, but they are used. So you might see corticosteroids utilized in some cases after surgery to reduce post-operative pain. I tend to see corticosteroids used more for chronic pain, but I just wanted you to be aware of it because you could see them post-operatively. Note that corticosteroids cause hyperglycemia. So you might be looking at your patient's lab results and see a blood glucose level of 160 and think, why is their blood glucose so high? They don't have diabetes. Well, go and look and see if they're taking a corticosteroid. That would be a very common reason for an unexplained increase in blood glucose levels. Now, long-term use of corticosteroids can lead to all kinds of complications, such as delayed wound healing, hypertension, osteoporosis, mood swings, and increased risk for infection. If you want to take a deeper dive into corticosteroids, go way back in my podcast library and look for episode 84. Now, another medication that you might see utilized are skeletal muscle relaxants. When used for chronic pain, I typically see these utilized after surgery, especially back surgery, though I have also seen it utilized after hysterectomies. It tends to be very helpful after that kind of surgery as well. And a commonly utilized medication in this class is diazepam, and is simply going to relax the muscles, which can get really tense, especially with that back surgery. Back surgeries can be very, very painful. There's tons of tension held in the body associated with that pain, associated with the trauma of the surgery, and a skeletal muscle relaxant can help quite a bit. And then one more medication utilized for acute pain would be local anesthetics. Local anesthetics are often used after surgery to help decrease the amount of opioids that we need to give patients. A commonly utilized medication is ropivacaine, which is infused through a catheter to basically numb the nerves in that target area. Now, I do have an episode all about local anesthetic systemic toxicity, which is episode 336, because even though these medications are localized, doesn't mean that they can't get into systemic circulation and cause toxicity. So if you're using these medications or taking care of patients who are using these medications, it's really helpful to know what the signs of systemic toxicity are. And I share them all with you in episode 336. In addition to pharmacologic interventions for acute pain, there are also lots of non-pharmacologic interventions that you can do. So a key one is RICE, R-I-C-E, which stands for rest, ice, compression, and elevation. So I do this a ton with my patients. Let's say they've had knee surgery, and so it's already wrapped. So we've already got compression covered because it's got the bandage on it from the surgery. Resting, obviously, they're in the recovery period, they're resting. I will provide ice and some pillows, get that leg elevated. You know, you might see this done after you sprain your ankle, for example. You're going to rice it. You're going to rest, basically stop walking on it, put some ice on it, wrap it in an ACE bandage, and get it elevated. That's going to help immensely. You can also use heat. You can use distraction. I don't know about you, but when I'm in pain, I like to maybe watch a movie or listen to an audiobook. Unless I've got a headache, then I just don't want to be bothered with anything. But if it's something else, distraction can be really helpful. And positioning. Let's say you've got a patient who's in the hospital and you're taking care of them and they have some pain in their back. So oftentimes repositioning them can be really, really helpful for that. So you might also be asking, well, when do I use ice and when do I use heat? Because you mentioned both. Yes, I did. So heat is utilized to improve blood flow. It is used to relax muscles and reduce stiffness, while cold is utilized to decrease inflammation. So for example, I'm going to use ice for that sprained ankle. But if I've got somebody who's got bad cramping from menstrual cramps, a heating pad is going to be their best friend. All right, let's take a quick break, and then we come back. We'll talk about the many ways that chronic pain is treated.
Empower your business or digital agency with Bluehost, trusted by over 5 million WordPress users globally. Bluehost features top-to-bottom hosting optimizations designed specifically for WordPress, giving you 24/7 access to a team of experts for support, plus thousands of WordPress help articles. So if you want to streamline WordPress website creation with intuitive controls and premium support, choose Bluehost, powering over 2 million websites worldwide.
So now we're looking at different treatment modalities for chronic pain. So as I mentioned earlier, chronic pain is more complex, and it is definitely going to be more complex, not only in the causes and the pain signals in the body and those disrupted pathways, but it's also really complex in its treatment and often relies on a multimodal approach that includes medications from a variety of drug classes as well as complementary therapies. So in addition to the medications I've already mentioned, which are often used for acute pain, those are also often used for chronic pain as well. Here are some others we're going to talk about specifically for chronic pain. We're going to look at antidepressants, anticonvulsants, local anesthetics, skeletal muscle relaxants, corticosteroids, bisphosphonates, antihistamines, and botulinum toxin. So let's start with antidepressants just very briefly. Antidepressants such as amitriptyline, which is a tricyclic antidepressant or a TCA. Another medication often used is duloxetine, which is an SNRI, are often used to address various types of chronic pain, including back pain, fibromyalgia is another one, and neuropathic pain. So when you are looking at your patient's medical record and you're looking at the meds they take at home, or maybe they're being prescribed here in the hospital, and you see that they've been prescribed an antidepressant, but you don't remember seeing or hearing anything about depression in their history, ask yourself if this medication is possibly being used to treat a chronic pain condition. Many times the answer will be yes. All right, so next we have anticonvulsants. This is another one where you might look at it and think, wait a minute, my patient doesn't have a seizure history. Why are they taking an anticonvulsant? And that is because they're used for chronic pain. So specifically, one that is very commonly used is gabapentin, and it's often used to treat pain associated with postherpetic neuralgia and diabetic neuropathy. Now, the important thing to know about gabapentin is that it's not going to address the underlying cause of the pain, but it does lessen pain by changing the way the body senses it. Now, earlier I did mention local anesthetics as a treatment for acute pain. You will also see these used for chronic pain, and one way you may see them used are with patches, with topical applications such as a lidocaine patch. You will often see this used for chronic back pain. Now, that's not to say you can't go to the pharmacy and buy yourself a lidocaine patch when you pull a muscle, which would be using it for acute pain. But oftentimes in the clinical setting, you're going to see it used for chronic pain as a way to address that without using a systemic medication, especially an opioid medication, or reducing the use of those medications. Another one that I mentioned earlier were skeletal muscle relaxants. You'll also see these used for chronic pain. Common ones are baclofen and cyclobenzaprine. I tend to see baclofen more often. These are primarily used to treat muscle spasticity, but they also have many beneficial effects in the multiple types of neuropathic pain. So you could possibly see it for neuropathic pain as well. And then corticosteroids. I did mention those for acute pain. You will also see them used for chronic pain. They work by reducing inflammation, reducing edema, and nerve depolarization, which makes them really effective adjuvants for chronic bone pain and neuropathic pain. And then bisphosphonates, which are medications used to treat osteoporosis. You might see these used to decrease bone pain associated with some types of cancer. Another medication that you would not ever probably suspect is being used for pain are antihistamines. Antihistamines such as hydroxyzine or diphenhydramine can reduce anxiety associated with chronic pain and may help muscular pain as well. And then botulinum toxin, which is commonly known as Botox. This is a local medication that relieves muscle spasticity, which can contribute to migraine headaches. So a lot of times you might see your migraine sufferer get Botox or botulinum toxin injections, and it's not because they're vain like me and get them for their fine lines on their forehead. They're getting them to actually decrease migraine headaches. So the key takeaway here about chronic pain medications is that many times these medications are not typical pain medications. You're going to see medications that are used in all kinds of other health conditions, but in this instance, for your chronic pain patient, they're being used to treat pain. So whenever you see a medication in your patient's chart that doesn't match up obviously with their medical history, you need to think, I wonder if this medication is being used for an alternative reason. And that alternative reason, in many cases, could be pain. Now, what about non-pharmacologic treatments for chronic pain? There are quite a few. So the first one I want to mention is cognitive behavioral therapy, or CBT. This specific type of therapy may be utilized in your patient with chronic pain to help the individual cope with the emotional and mental health burden of chronic pain, which can be absolutely significant. I mentioned earlier, it can cause depression, insomnia, anxiety, and fatigue. CBT can help the patient cope with all of that. Another non-pharmacological treatment for chronic pain is physical therapy. Physical therapy may be utilized to improve strength and mobility in the pain sufferer. In addition, physical therapists can help the individual with pain management strategies and help them develop a plan that is unique to their specific type of pain, because remember, it's going to be different from one patient to another. Another non-pharmacologic treatment is acupuncture. Studies show that acupuncture can help reduce chronic pain, and as a bonus, the effects can persist over time. So it can provide some longer-term pain control. Another really interesting one is spinal cord stimulation. A spinal cord stimulator is a small little device that is implanted surgically, and I've taken care of lots of patients after surgery who have gotten these implanted. And what it does is it sends low levels of electrical stimulation directly into the spinal cord to reduce or relieve pain. It's very, very cool. Another type of stimulation is a TENS unit, which stands for transcutaneous electrical nerve stimulation. So a TENS unit is also a very small device that sends low levels of electrical stimulation to relieve pain. Now, it differs from the spinal cord stimulator in a couple of ways. First of all, it's not implanted surgically. It's going to submit the stimuli through the skin, so it's transcutaneous. Second, it does not send the signals directly to the spinal cord. Instead, it delivers the current to nerves at that target area to relieve pain. And then a couple of newer modalities that are being looked at and utilized are pain reprocessing therapy and nerve ablation. So pain reprocessing therapy utilizes a behavioral approach to reduce or eliminate pain. And it's very interesting. With this therapy, patients work with a therapist to perceive the painful sensations they experience as less threatening, so that over time, the brain essentially unlearns the pain. That's fascinating to me, and the studies are showing that it is helpful. Another one is nerve ablation, which has been used in, I believe, back pain for a long time, and it is now being looked at for other types of pain. So in this procedure, nerves around that target area undergo ablation, which is a procedure that essentially damages them, and it damages their ability to send those pain signals. So the patient experiences less pain. So there you have it, your quick, I hope, half-hour overview of acute versus chronic pain. Your too long didn't read is this. Acute pain is a short-term protective response to illness or injury. It is usually characterized by sharp and localized discomfort that resolves as the underlying cause is removed or heals. Chronic pain, on the other hand, persists for more than 3 to 6 months and can often lack a clear cause. In addition, chronic pain significantly impacts physical, emotional, and social well-being. Effective management for each involves tailored approaches, and treatment for acute pain is going to focus mostly on analgesic medication and resolving the underlying cause, while chronic pain requires a complex, multidisciplinary, long-term strategy utilizing a variety of therapies. Now, before I close out with you today, I do have an exciting update about the Straight A Nursing podcast, and that is starting next year. which is just in about a week, right? I believe this episode airs at the end of 2024 on December 26th. So starting next week, you are going to hear from me more often. So how do you like that? So what you are going to get is Monday episodes called Mo's Monday Minute. And these are quick little episodes sharing a quick tip or a quick bit of advice or a quick little bit of info that you can, depending on your role, where you're working, whether you're a nurse or a student, but ideally, for the most part, that you can start implementing right away. So those are called Mo's Monday Minute, and those will be every Monday. And then I will also be pulling some select episodes from the archive. So you've probably noticed we have a lot of episodes right now. So I'm pulling some from the archive and republishing them as encore episodes because these are episodes that I definitely don't want to get lost in the mix of over 380 episodes. And definitely want you to hear them. So you will be seeing encore episodes in your podcast feed as well. So those are the big changes coming up. I hope you enjoy them. I hope you enjoy hearing from me on Mondays as well as Thursdays. And if there's anything that you want me to cover on the podcast, I'd love for you to shoot me an email to team@straightanursingstudent.com. And if it's something we haven't already covered and it's a good fit, we'll add it to our list. So if you're listening to this episode in real time when it is aired, I want you to have a joyful end to 2024 and a hopeful and joyful beginning to 2025. And I will see you very soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Saucony owns the streets at dawn. Saucony keeps the pace with run crews. Saucony also moves through music festivals and strolls to neighborhood coffee shops. But Saucony is not just about where you go. It's also about who you're with, bringing you closer and connecting you to those who move like you do. Saucony, the original running brand built on heritage and innovation. Shop your local run and lifestyle retailer or at saucony.com.